I would like to see us rely on medications a lot less. When I first got my prescription pad as a nurse practitioner, I thought, now I can really make a difference for people. And I thought, oh, if I just get them on insulin sooner, they'll do better. And I'm a nurse. I know how to teach people how to give an injection so it doesn't hurt, and I can get them over that fear of needles. Well, what I've come to find is that insulin causes weight gain. Insulin causes low blood sugar. Insulin is really expensive, and there's no generic insulin available, and there are no plans for generic insulin anytime soon. And people can spend $400, $500, $600 on insulin now. So there are a lot of reasons to look beyond insulin as the best treatment for type 2 diabetes. And although there are a number of pills available and other injectables available, they are not without their problems. You know, if they were a cure, it would be one thing, but they are not. There's not a single case of anybody having their diabetes cured by any prescription medication. So I'd like to see us use a lot less medication. And it's only recently that we've come to learn that this holy grail that we have been using as our goal in diabetes, by holy grail, I am referring to the blood test, the hemoglobin A1C, this measure that we use to find out what has somebody's average blood sugar been over the last 3 months. And a normal A1C is between 4 and 6%, and up to 7% is considered good control. So for a long time, the goal has been to get everybody's A1C down below 7%. And we would do that, we'd use whatever means were necessary. 1 medication, 2 medications, 3 medications, insulin, injectables, whatever combination to try and get people to that goal. Well, guess what? In October of last year, there was a meta-analysis published. That means that there were a number of different studies put together that showed that even when you get people's A1C lower, that what you do is improve what is called an intermediate marker. And what that means is their blood sugar numbers get better, or they have less protein particles in their urine, or they have a little less damage to the retina in the back of their eyes. And these are clinical measures, but they have nothing to do with quality of life. What we want to study is, do these medications prevent people from having circulatory problems that lead to amputations? Do these medications keep people from having heart attacks or kidney failure or losing their eyesight? These are measures that are really important, and that should be our goal of diabetes care, not some lab numbers that may or may not keep people from developing these horrible life-altering complications. So our focus has always been on blood sugar control, and you can get great blood sugar control with medication. You can also get great blood sugar control with diet changes. And the benefit to doing it with diet changes is that it does so much more than control blood sugar. Plant-based diet has shown to do all kinds of good things from head to toe. And what I've seen with my own patients who adopt this way of eating is their blood sugars get better, sure, but if they're overweight, they lose weight. If their cholesterol is high, that comes down, lowering their risk of developing heart disease in the future. People who complain of constipation no longer have that problem. People who have chronic headaches or migraines often find that those go away. Joint pain is a big thing. I see a lot of people who have arthritis, and changing to a plant-based diet often can improve joint pain. There's all kinds of benefits, and you don't have the expense and the side effects and the risks of taking all of these medications. It was really surprising to me to learn that for the FDA to approve a medication for sale, that medication only has to lower blood sugar. Diabetes medications are not approved because they prevent a heart attack or prevent kidney failure or prevent a stroke or an amputation. And I think if my patients knew that, they would probably be a lot less quick to agree to get medication for their diabetes and to stay on medications. A lot of the patients who come in to see me in the medical practice have a long list of pills they keep in their wallet. And, we're looking at this, and they're on 2 or 3 pills for their diabetes and something for their cholesterol, and they might be on 1 or 2 blood pressure medications. They may be on an antidepressant. Men might be on something for erectile dysfunction. They're on all of these medications. And the beauty of a plant-based diet is it can address all of these problems.